first one is longitudinal.
There is two groups. One is coronary group and the longitudinal group. Coronary group presents in the base of the heart, and this is look like a circle but not a complete circle. It is interpreted. This is the coronary group. Okay, this is the coronary group, and it is interrupted by another vein, the pulmonary vein, and this is also in this shape. This is also coronary group, and this is interrupted. This is not a complete one. And there is another group, is longitudinal group. This longitudinal group is two part, in which group is present in the left side is called
Paraconal group.
paraconal group. This is the left side, and there is the group, and this is the group. Okay, this group is called paraconal group. In the there is in the right side there is also a longitudinal group. This is called subsinusal group.
I think this whole is a paraconal group. This whole.
It's just pause. The groove is covered by fat, and beneath the fat there is the presence of artery. On the left side, the inside, this is the left atrium and this is the left ventricle. In left atrium there is connected pulmonary vein from the lungs. There is 6 pulmonary vein in case of ox, and there is 7 or 8 pulmonary vein in case of horse. In this side, the inside, the internal portion of the atrium, there is a small place and there is an elevated place. Which one is this is an elevated place, right? The elevated place is called what? Pectinate.
Papillary muscles.
No, in case of atrium, this is pectinate muscle.
Pectinate muscles.
And there is a small portion. After this, there is a valve. Atrioventricular valve
Opening.
between the left atrium and ventricles. This is called the bicuspid. This bicuspid.
Yeah, bicuspid.
Can you identify here bicuspid? There is the quaternary.
Yeah, bicuspid in two examples.
This is the bicuspid, or it's also called atrioventricular opening, the bicuspid or mitral valve. And bicuspid valve also connected with some fiber-like structure. This is called chordae tendineae, and chordae tendineae is connected through a elevated portion of the ventricle is called the papillary muscle. And after beneath the ventricle, in case of left ventricle, there is the position of the apex, and from inside of the apex there is some thread-like structure is called moderated band. And from the left ventricle there is a aorta coming. There is aorta originated from the left ventricle, and this aorta is go by this way, and there is also a valve, and this valve is called semilunar valve. Inside there is a semilunar valve, pocket-like valve. There was a valve, pocket-like valve. It's called the semilunar valve, and it makes the direction one way of the blood flow, and aorta supply the blood to the whole body. And this is our right side of the valve, the right side of the heart, and in the right side, there is, you can see, the inside portion. This is the atrium. This is the atrium, and there is also a atrium, and there is a valve connecting here. This is called tricuspid valve, and there is also present of the chordae tendineae, and the elevated portion of the ventricle, also called as same as the left ventricle, is papillary muscle, and there is the smooth portion of the atrium, and there is a elevated portion of atrium is called as pectinate muscle. And from this side, from the right, which one is this? From the right atrium, the pulmonary atrium is originated atrium. This is right ventricle. By this way, this is the way of the pulmonary atrium, the pulmonary artery. The pulmonary trunk. This is originated from the right ventricle, and it supplies the deoxygenated blood to the lungs. In the right side of the heart, there is blood is coming from the body. Deoxygenated blood will come to the right atrium through this vena cava. There is two vena cava. One is the cranial vena cava and caudal vena cava. And there is a septum between the right side and the left side of the heart. This is a very thick septum. This septum divides the chamber in two parts, the right part and the left part. These are the coronary artery, and this supplies blood to the surface of the heart. This.
And then the other side.
Also this present in the both side. Coronary artery is shown. This one the coronary artery here, and this supplies blood to the body of